Comparison of the clinical efficacy of craniotomy and craniopuncture therapy for the early stage of moderate volume spontaneous intracerebral hemorrhage in basal ganglia, using the CTA spot sign as an entry criterion. Via clinical neurology and neurosurgery. alertIcon.gif. Publication date, available online April 3, 2018. Source: Clinical Neurology and Neurosurgery. Authors: Chunyan Ge, Wangmiao, Hongo, Zhaosheng Sun, Wanzeng, Xiaowei Li, Xuehui Yang, Jinrong Zhang, Dongxin Wang, Yixiang, Jian Huaimao, Wenchao Zhang, Haogo, Zhang, Jianxiao Chen. Objective surgical treatment is widely used for hematoma removal in spontaneous intracerebral hemorrhage (ICH) patients, but there is controversy about the selection of surgical methods. The CT angiography (CTA) spot sign has been proven to be a promising factor predicting hematoma expansion and is recommended as an entry criterion for hemostatic therapy in patients with ICH. This trial was designed to evaluate the clinical efficacy of two surgical methods, hematoma removal by craniotomy and craniopuncture combined with urokinase infusion, for patients in the early stage, 6 hours from symptom onset, of spontaneous ICH with a moderate hematoma volume, 30 ml 60 ml. Patients and methods from January 2012 to July 2017, 196 eligible patients treated in our institution were enrolled according to the inclusion criteria. The patients were divided into the CTA spot sign positive type and CTA spot sign negative type according to the presence or absence of the CTA spot sign. For each type, the patients were randomly assigned to two groups, that is, the craniotomy group, in which patients underwent craniotomy with hematoma removal, and the craniopuncture group, in which patients underwent minimally invasive craniopuncture combined with urokinase infusion therapy. Neurological function was evaluated with the Scandinavian Stroke Scale, SSS, at day 14. The disability level and the activities of daily living were assessed using a modified Rankin Scale, Mrs., and Barthel Index, BI, at day 90. Case fatalities were recorded at day 14 and 90. Complications were recorded during hospitalization.ResultsFor the CTA spot sign positive type. The craniotomy group had a higher SSS than that in the craniopuncture group, P0.05, at day 14. The rebleeding rate was higher in the craniopuncture group than that in the craniotomy group, P0.05, during hospitalization. The craniotomy group had a lower misses than that in the craniopuncture group, P0.01, and had a higher BI than that in the craniopuncture group, P0.05, at day 90. There was no statistically significant difference in the fatality rate between the two groups. For the CTA spot sign negative type, there were no significant differences in the SSS, misses, BI, fatality rate and complication rate between the two groups. ConclusionICH can be divided into the CTA spot sign positive and negative type according to the presence or absence of the CTA spot sign. For the CTA spot sign positive type, patients can benefit from craniotomy with hematoma removal, which can reduce the postoperative rebleeding rate and improve the prognosis. For the CTA spot sign negative type, both craniotomy and craniopuncture are applicable. Considering simple procedure and minor surgical injury, craniopuncture can be a more reasonable choice. Add tags: currently, Neurology, Medicine by Alexandros G. Sfakianakis,